Leah, a 68-year-old female, presents to the clinic with back and right leg pain. She looks very stiff and walks with a crouched and intelligent gait. The patient is healthy with no comorbidities. She used to see a chiropractor for back problems about 20 years ago. She takes multivitamins, walks 3 miles twice weekly, and plays pickleball on the weekends at the senior center. Hey Leah, so I'm just going to ask you a couple of questions about what's going on with you today. Is that okay?
Yeah.
Alright, so have you seen a doctor for your issue? Are you visiting anyone else at this time?
No.
Okay. And then are there any other symptoms that you're experiencing right now in addition to your back pain and your leg pain? Like, are you experiencing any numbness and tingling?
No and no.
Okay. So on a scale from 0 to 10, 0 being no pain, 10 being the worst pain,
Yeah.
what is your pain level right now?
Yeah, so right now it's about a 6, but it can get up to a 9 the longer I stand or walk around. It usually goes down to like a 2 or a 3 if I sit down though.
So a 9 at its worst, 2 or 3 at its least, and then you said a 6 right now?
Yep.
Okay, cool. And then how would you describe your pain?
Yeah, so it's like an aching in my back. It'll shoot down towards my leg. That's about it.
Okay, and what are some of the things that you're doing to like relieve your symptoms?
Yeah.
What helps?
Yeah, so sitting helps, bending my legs. Sometimes I sleep with my legs curled up, like in a fetal position. I try and lean forward when I stand, and I use icy hot, and I take Aleve if the pain becomes like too much.
Okay.
Yeah.
And then what makes your symptoms worse?
So standing or walking for long periods of time, I can't go on my walks anymore because my back will start to hurt about like 10 minutes in. Same thing with pickleball. When I lean to the right, the pain comes back as well.
Okay. And then how often are you experiencing your symptoms or your pain? And then how are you feeling these symptoms right now?
Yeah. So my back and legs hurt every day. I don't feel the pain too much right now, but I think that's just because I've been sitting since I got here.
Okay. And how has this affected your sleep?
Yeah. So I can make it through the night if my legs are curled up. I can't sleep on my back or on my left side without my back and leg hurting after a while though.
Okay. And do you work? Like, what positions are you mostly in? What's your activity level like?
Yeah, so I'm retired. I typically hang out with my friends at the senior center. We crochet, play spades, and garden outside. There are so many activities. I even do like water aerobics at the pool. I've been sitting a lot, more this past month, and it has been hard during my normal activities, or hard to do my normal activities.
Have you had any surgeries in this area?
No.
Do you have a history of like rheumatoid arthritis or any other inflammatory conditions?
No, but my great aunt had arthritis.
Okay.
Yeah.
Have you had any issues with your bowel or bladder function?
Oh yeah, sometimes I'll like pee a little bit when I laugh or sneeze. I started doing that after I had kids, and I had 7.
7 kids?
Yeah, 7
okay.
kids.
Alright, well those are all the questions that I have for you. We're going to start with our program or treatment and try to help you out today and see what's going on, okay?
Okay, great.
Alright. Okay, Leah, so I'm going to get started. So I'm going to have you stand in front of me and you can just look at me.
Yeah.
And is there a way you can take your hoodie off or just lift it up a little bit?
Yeah, I can lift it up. I can take it completely off if you want.
Okay, great. You just want to look at your posture.
Yeah.
So take a look at you from the front and from the back. So can you turn it face that way for me? Okay. And then I'm just going to palpate for your PSIS and look at your height. You're good. And then can you turn to the side? Good. Your posture looks good. Okay, cool. So I'm going to have you do some range of motion. So I'm going to ask you to face that way, and then just bend and touch your toes as far as you can. And can you take a couple steps back for me? Towards me, sorry. There you go. And bend and touch your toes. And then we're just gonna look for any flat areas on your back. And then I'm gonna press you down just a little bit more. Okay, good. And then try to resist me.
Okay.
And then, did you have any problems there at all?
No. It just feels like a little tight.
Okay. And then I'm gonna have you put your hands on your hips, and you're just gonna lean back towards me. Okay. Any problems here?
No. But I know if I like stay like this, then I'll get a little bit of leg pain.
Okay. I'm gonna have you, and you can look at me first. I'm gonna show you what I want you to do.
Yep.
You're gonna take your hands and you're just gonna slide them down your leg and bend, and then you're gonna do the same thing on the other side. Okay. And then you can go back to the right.
Yeah.
And I'm just gonna press you down a little bit more. And we'll take you out, and then don't let me push you towards the floor.
Yeah.
Okay, good. And we're gonna do the same thing on the other side. And then we'll take you out, and don't let me push you towards the floor. Do you have any issues with either your right or your left side? Okay.
Yeah.
Cool. It's good to know. And then what I'm gonna have you do is stand close to this table.
Okay.
And then on your right leg, I want you to do 10 heel raises. And then you can turn around and do the other leg. Okay, perfect. You can sit for me.
Yeah.
And I'm going to have you come to the edge of this table. And I want you to sit on the corner and have your knees pressed against the back of the table. And can you just cross your arms like that? Okay. And I want you to turn this way. And then I'm just going to show you a little more. And then you can come out of it, and don't let me push you that way. Good. And then we're going to flip our arms and go the other way. So what we're going to do next is have you lay on your back,
Okay.
and I'm just going to assess your hip motion.
Yeah.
Because sometimes we can get back pain because we have problems in our hips.
Yep.
Or the reverse can happen. Our back pain can cause problems in the hips. So you just want to make sure that is not a factor right now. All right. So you can lay back. Now move your glasses out of the way. And I'll come on this side. You can just relax, and I'll move. And let me know if you feel any pain or discomfort with any of the symptoms. Anything wrong there?
Nope.
Okay, so now I'm going to do some monotone testing. So I'm going to have you bend your knee right here, and then don't let me push your leg that way. So for MMTs, we hold it for 3 seconds, monotones 10, and then I'm going to hold your leg like this. Don't let me push your leg in.
Okay.
Resist me. Good. And then don't let me pull your leg out. Good. And then your big toe, I want you to point it towards you. Good. And don't let me pull it out. Good. We're gonna have your foot in like this. Get out. To the opposite way. Okay, good. And then you can lay like this. I am going to do some sensation testing on you. I'm going to use this, and I'm just some areas of your skin. You're gonna have your eyes closed, so close your eyes. This is what it's gonna feel like. Okay, and then you just say yes when you feel it. And we'll just go from there. Okay. Also test the upper extremities too, but we're good. And then we're going to do a straight leg raise. So we're just going to lift this leg. Any symptoms? Okay, this one. Any symptoms? What I'm going to do is called the Oppenheimer test. This. Okay, and then this. I'm just going to use the bottom of this reflex hammer. And I'm going to stroke the bottom of your foot. It may tickle a little bit. Okay. Okay. Check my flowness. Closer to me, and we're going to bend your knees, lift them, just lift them up, and then I'm going to press in. Do you have any symptoms with this motion?
No, I don't think so.
Okay. And then I'm going to just palpate around your hip area. Is that okay?
Yes.
Okay. So we're going to do some pressure hurts.
That's no problem.
Any symptoms with this?
No.
Okay. This way. Any symptoms with that?
No.
Okay. And what about this?
No, it's fine.
Okay, good. Now I'll have you lay on your side and you can face this way.
Okay.
I'm just going to put some pressure right here on your hip, and you let me know if there are any reproduction of symptoms.
Yeah.
Any problems here?
No.
Okay. And then I'm going to have you hold your leg up like this. Can you hold it here? Good. And then I'm going to press down. Don't let me press you down. And again, MMT is 3 seconds. Myotomy is 10. And we would test both sides. Now I'm going to have you lay on your belly. And right now I'm just going to bend your knee and lift it up. Any problems with this?
No.
Okay. Do the same thing with this one. Any problems with this?
No.
Okay. Now we're going to bend this knee and hold it up. Can you hold this position?
Yeah.
Okay. And then I'm going to try to push you down. Don't let me push you down.
Okay.
Good. And we would test the other side as well. I'm going to just put some pressure on some parts of your back. And you just let me know how they feel. So we're going to start 4. findings from the lumbar scan. All of the results of the active range of motion tests are listed. It is important to remember that pain was relieved with sitting, exacerbated by prolonged standing or walking, and that the neurological signs, straight leg raise tests, femoral nerve tests, dermatomes, myotomes were all negative during this scan. Alright, Leah, so we're going to do an H&I test now.
Okay.
And so what I'm going to have you do, and I'll help guide you in the motion, so I'll stand behind you. But we're going to put our hands on our hips just for some stability, and then we're going to push you forward. So we're going to make the letter I.
Yeah.
And we're just going to come this way, and this way. Good. And then we're going to go back. This way, and this way. We'll come back to neutral. Now we're going to make the letter H, so we're going to go to the right first. We'll go forward, middle, and back. Good. We'll do the other side forward. And perfect. Now I'll have you lay on your side on the table. And then I'm going to put some pressure on your side like I did before, but just in this area, okay?
Yeah.
And you let me know if there are any changes in symptoms. And then when we do this test, we would hold this for 30 seconds. The same as the ones that follow.
Yeah.
And then I'm going to have you flip to the other side. We're going to test the other side. Tighten your muscles right here. Good, and relax. Up. Good. Now, rotation. Sit at the end of this table, and we will lower this again. And with this test, I'm going to kind of give you like a bear hug.
Okay.
But I'm going to wrap around you, and I want you to put your hands like this against my shoulders. And when I say push, I want you to push against me, okay? We're going to do that a couple of times. Okay, go ahead and push. Relax, push, relax, push, relax, push, relax, push, and relax. Perfect. Thank you. Now we're going to do some pillows and pavos. So I'm going to have you lie on your side, and you can face the wall back there. And I'll just set up the top of this table again. this towel under your legs.
Yeah.
So that your legs don't stick to the table. So there you go. Scoot a little bit closer to me. Perfect. And we are just going to check for flexion to see how much your back moves. And so I'm going to pull, I'm going to stabilize the superior vertebrae and pull down the bottom. Just move at each segment. So from my findings, it feels like there's limited movement here at L3 and L4. And then we're also going to do side bending, so you're in a good spot. So what I'm going to do is lift your legs a little bit and push down. Again, there's some limited movement with the right side bending at L3, L4, and then we lift the legs to create the V motion to push down on the vertebrae. Okay. Leah, so we're going to treat your symptoms. I'm going to have you lay on your side and you're going to face the back wall of Kenneth. I'm going to put the towel over your legs, and then I want you to come this close to my hand. And because this is a problem that recently came up, we're going to lock up to your joint. So I'm just going to palpate for the L3, L4 segment. Here's L3, L4, so about right here. So do you mind straightening your legs for me and then bending them? Okay, good. And then we're going to take this arm and you can grab onto me, and I'm just going to pull you that way. Okay. And then you can put that arm around your head, and then you can bring this arm forward, and I'm just going to sleep around you, and we're going to pull you this way, and I got you, so don't. If you feel like you're going to fall off the table, you won't. And then I'm just going to do a grade 1 move right now. It's just going to follow my breathing. It's very light. On your back. And now I'm going to talk through some of the exercises that I want you to do at home to help you feel better. And I made a list for you.
Oh, good.
And we're just going to go through them, and I want you to try them. So the first one that I want you to do is a lower ab workout.
Okay.
So all you're going to do is bring your knees up, and then you're just going to tap your heels to the table. Pretty simple, but I want you to engage your core, so if you can try to just draw your belly button into like the bottom of the table and do that, and we'll work on that a couple of times. So we'll do this twice a day, and we'll do each leg 8 times.
Okay.
And then the next exercise, we're going to do pelvic tilts. So you can stay just like this.
All right.
And I'm going to stick my hand under your back so you can feel, but I want you to press your back down into my hand and then try to arch your back away from my hand. And again, press your back in and then arch your back away. And we'll do this 3 times a day, about 10 times. Yeah. So for this next exercise, I want you to be as close to the wall as possible. And what you're going to do is you're going to raise this leg, rotate it this way, there you go. And then you're going to press your heel into the table. And then you can lower it and come back up and press into the wall. And this exercise is going to strengthen your back muscles just so we can get around the area that's giving you problems and hopefully relieve pain and make you stronger. And I want you to do this twice a day, and you can do it about 8 times. Okay?
Yeah.
Thank you so much for working with me, and I can't wait to keep seeing you so we can help you get better and just improve your quality of life. So thanks for coming.
Yeah. Thank you.
Overall, the patient presented to the clinic with symptoms consistent with bilateral lateral stenosis at the L3, L4 lumbar spine segments, and with some weakened pelvic floor muscles that may attribute to the leaky bladder.